This is actually a talk to be given by the gynecologist, but we will tell from our point of view what is cesarean, why people are doing it and all. Now, what is cesarean? It is taking the baby out by making a cut in the abdomen, in the stomach, and you take the baby out uh, by after giving spinal anesthesia. Now, what is spinal anesthesia? It is a small injection given in your spinal cord so that your legs and other things will be painless. You can't move it or you can't feel the pain. Now, how long you stay after cesarean? Usually, certain gynecologists admit for 2 to 3 days. Certain gynecologists admit for 5 days. It depends from hospital to hospital. For minimum 2 days, you will have to be fasting. Yes, 6 hours. You need to fast before getting cesarean. Now, why people are going for emergency cesarean? Yes, emergency cesarean might be done if the baby's heart rate is having dipping of heart rate, if the baby has done potty, that is baby has passed stool inside the stomach, or if the cesarean is done is because it is not progressing. Why it is not progressing? There might be two reasons. Baby is big or mother may not have proper pains. So this imbalance. Suppose it's a 5 feet mother and the father is very 6 feet father. So at that time what happens? The baby might go for like the father very big baby. During lockdown we are having lot of cesarean. Mothers are eating a lot. Lockdown babies. Almost all the lockdown babies are 3.5, 3.3, 3.4. They heavy babies. So extra food, extra care and all. So that is a requirement. So for past a few 20 years it has been increasing the number of cesarean. Why it is happening? There are a few reasons in addition to what I have told. That is, the mothers are having vitamin D deficiency. During vitamin D deficiency, the pelvic floor will have bony projections because it is not normal shape. So babies don't come out. That is one reason. Second is a low quality diet, junk foods. Everybody like golgappa, biscuit and everything. These junk foods don't contribute to strength of the body. And another thing is they don't exercise that much. Previous time they used to do a lot of work. Now it is more of office work rather than heavy household work, because mixie has come, grinder has come, washing machine has come, vacuum cleaner has come, everything has come easy. So that is another reasons. Now babies are also becoming taller and heavier, that I mentioned. Now what are the complications of cesarean? Cesarean, there will be pain. Your stitches will pain for a few times. Stitches will have some infection if not properly taken care of. Okay. And back pain after cesarean, it can happen because the stitches might be irritating some nerves or something, but it is not very common and not due to spinal anesthesia. And how long after cesarean you will be allowed to take food? At least for 1 day you will be in drip. After passing gas only they will allow you to take food. That is in Punjab, that is a very important drawback, because people will ask, I want food. But because of spinal anesthesia you can't move at all for at least 6 hours. They won't allow you to move even your head or raise your head because you will get headache. The only problem which pediatricians will face is because of cesarean, milk output will take 2 to 3 days. That is the only reason. And movement and taking care of the baby will be difficult. So people need to help the mother. Long term complication of cesarean, no much. But there can be adhesion. Some people are really sensitive to stitches and everything. Internally there will be small intestinal adhesions which can cause long-term problems in future pregnancy, or like during the next cesarean it will be difficult to take care of it, and during the next delivery this cesarean scar will have some amount of injury or rupture. So usually during ultrasound they will ask the ultrasound person to look for the scar, whether it is gaping, whether it is thinning out. At that time, if it is there, they'll prepone or electively do a cesarean in the next pregnancy. So cesarean, basically people uh, uh, doing it for money. There have been incidents in which the parents accuse the doctor is doing cesarean for money. No. It doesn't seem so, because planning for a cesarean and admitting and then keeping the person for 5 days, these are all troublesome things. No gynecologist will be ready to take the risk. Everybody will prefer normal delivery, a baby come out and just leave. Most of the charges of cesarean, why it is extra? It is because extra 2 days of admission or 1 day of admission or 3 days of admission, plus anesthesia charges and medicines are extra. That is the reason why it is a lot of drip, you need to lot of medicines and painkillers and all. That is the reason why the charges are going. Most of the charges will be 10 to 15,000 or 20,000 extra than normal delivery. Not like cesarean, if you do a lot of charges they can charge. Not like that. Nobody does like that. It might be 100 out of 100, 1 or 2 might do. That I am not sure, but as far as I know, I have worked with many doctors, nobody does that. Everybody prefer normal delivery. It is done, clean, gone. And after cesarean, how long the mother need to stay in bed? You don't require too much of bed rest. After 1 day you can start moving your legs, and the next day, day after, you can start moving a bit. It is not a contraindication for not moving at all. If you don't move at all, you can get thrombosis, clots in your legs, and that can dislodge and go into the lungs and cause problems. So that is very important. It doesn't mean you absolute rest. You will need to have painkillers and support for a few days, and keep that area clean so that your stitches doesn't get infected. So these are the things you need to know about cesarean. Now, last question: what extra can be done for babies who are born by cesarean? Definitely, if it is a very big baby, then sugar monitoring is required, and for a few days you will have to carry emergency glucose, so that at home also, if you feel the baby is lethargic or something, you can give this glucose. And we have an stomach strengthening immunity booster available for cesarean babies. Especially you can use it for normal babies also. That is Superflora. You can give it for 30 days daily, so that the stomach strengthening can also happen. It is very important. To whole talk, I will summarize why cesarean is being done. Maternal indication or baby indication. Baby might be in distress or might be big baby. The maternal indication, it might be a very small mother, small pelvis, non-progress of delivery, or too much unbearable pain. Complications of cesarean, stitch infection or something, or long-term complication, there is hardly any long-term complication. There can be some adhesions which can hamper the next surgery or any other future surgery in some patients. Now what you can do for the baby, you can give extra Superflora drops, and if it is very big baby, you sugar monitoring and extra sugar and all you might require. You can share this video if somebody likes it. You can they are very much afraid about cesarean or something. There is nothing to be afraid of. These are all taken care of. And another thing is, government and the doctors having a fight in between cesarean. There is nothing wrong with the doctors. People are becoming weaker, the strength is less of exercise, more of gadgets like washing machine and other things, and have come. That is the reason. And vitamin D deficiency leading to bone deformation in mothers, and too much of diet leading to big babies, especially lockdown babies. That is the reason why cesareans are increasing. There is nothing. And doctors doing cesarean for extra money, it is all these are all media cooked up things. These doctors are very happy with sending the patient early home rather than keeping the babies, because most of the hospitals have a good turnaround. They don't keep unnecessary patients. You could lead to more hospital acquired infection and more complication. So take care, have a good day.